Okay, it's Dr. Peter here. I think we were talking about diabetes on one of the recent little clips I was doing, and I think we're talking about endocrinologists. But I will just introduce myself, Dr. Peter, and I'm a medical practitioner in Queensland, Australia. And diabetes would be half our work. Diabetes used to be half our work. It used to be not that common a disease, but it is now incredibly common. I think there's a new diabetic diagnosed in Australia every 6 minutes, but don't quote me on that. Diabetes, look, basically it's split up into two categories: type 1 diabetics, who are the old form of diabetics that people used to know about and used to die from. It's basically when you stop producing insulin, your sugar goes through the roof. This would often happen to young people, teenagers, and they'd end up in hospital incredibly sick. And if they were not given insulin, they would probably not make it. So the discovery of insulin fixed most of the type 1 diabetes, but they are on that for life, obviously. But most people in Australia that have diabetes have what we call type 2 diabetes, which is really, it's a complex metabolic problem, and you would need a degree in biochemistry and pharmacology to understand it. But basically it's that you don't have a metabolism which is metabolizing sugar correctly, and so your sugar starts to rise. And people ask, what is the problem with your sugar rising? Your basic problem with your sugar rising is that your sugar, if it rises, is going to adversely affect just about all the organ systems in your body, and particularly with diabetics, it affects the circulation. So if your sugar is constantly up, you are at much greater risk of getting cardiovascular disease, having a stroke. It particularly affects the circulation in your legs, so you're quite likely to get poor blood flow to your peripheries, and of course the most peripheral being furthest away from the heart. The most vulnerable part of your body in terms of circulation is your toes. So there are literally hospital wards which are dedicated to the treatment of diabetic toes. Diabetics, if they don't look after their feet, if they don't look after their sugar rather, their feet are usually the first thing to cop it. And with poor circulation, which means not enough oxygen getting down there to the toes, and also with one of the other effects of diabetes, that it poisons your nerves. So often your feet will also go numb, so you might injure your toes, you might get ingrown toenail and not know about it, you might step on a thumbtack and not know about it, so you're far more prone to get infections. And if you get a bit of an infection in your foot and you have poor circulation, that puts the foot under a lot of pressure to try and heal, which it often is not capable of. Then you get a breakdown, an ulcer, and it presents enormous problems for the hospital system and your family doctors trying to get that under control, because it is not an easy thing to do to get an infection out of a foot. And there are plenty of amputations go on, mainly for toes, but then extending further for people who have not controlled their sugars. So that's probably the major thing that we see. But I mean, diabetes affects everything. You're way more likely to have a heart attack, way more likely to have a stroke, way more likely to have kidney disease because the sugar's toxic to the kidneys. So you're way more likely to your kidneys to pack it in early, which will mean that if that continues, you're going to eventually require dialysis if you live long enough. And the number of people on dialysis, I would imagine a major percentage of them are on it from diabetes. Diabetes also poisons the eyes because it affects the small blood vessels. This another place where there are very small blood vessels in the back of the eyes, in the retina. So you're going to get little cuts off in circulation in the back of the eyes, you're going to get bleeds, you're going to get scarring, you're going to get damage to your retina, and your vision's going to deteriorate, and it's also going to affect your lens, so you're going to get cataracts, and your vision's going to deteriorate from that. And literally, outpatients, departments, and ophthalmologists, again, they build wards just to look after the effects of diabetes. For this, there are just a constant stream of diabetic patients going in, having laser therapy to try and maintain their eye function, and to try and stop them going blind. Some of that can be quite painful. They have to do injections in the back of the eye, and all sorts of expensive concoctions and chemicals that they inject to try and keep the retina going. So please take diabetes incredibly seriously. It's an incredibly serious disease. Most people don't take it seriously enough. I'll have to split this up into about 20 little bits to even scratch the surface of diabetes. So that's enough for that one. Thank you for listening, and we'll post another one soon. Thank you.